As a part of those preparations for the worst, the government hopes that home-based care will help ease the burden on already stretched public hospitals. Today, the Ministry of Health outlines the guidelines for home-based care. So how will it work and who qualifies? Gina Kirori has more.
With the bow wave of coronavirus infection still to come, the country is still trying to prepare for a flood of critically ill patients who could strain the healthcare systems like nothing we've ever seen before. Care of patients at home is expected to ease the burden on hospitals already stretched to capacity.
We are now better informed about our individual responsibility in this campaign, and I would like here to thank those in Nyumbakumis.
The Ministry of Health is developing protocols on how such patients can be minded at home based on the guidelines issued by the World Health Organization. Apart from presenting a COVID-19 positive report from the laboratories, a patient must be asymptomatic or have a mild form of the disease based on the triage from a doctor. They must not have a pre-existing condition such as high blood pressure, diabetes, or chronic chest pain or chronic kidney problems. In addition, one must have adequate space in the room they choose for home-based care, which is separate from the rest of the house and is well ventilated. Attention to the prevention control guidelines must be prioritized. Washing hands, use of sanitizers, and wearing of masks and gloves are mandatory. Only the caregiver and the patient can access this room, and they must wear protective equipment. In case the patient's situation deteriorates, there must be an identified healthcare center that they can call in case of an emergency. And lastly,
you must have adequate space, preferably a separate room from the rest of the household members, where you'll be able to stay during this isolation or quarantine.
Following the World Health Organization's guidelines on home-based care, the government is now set to enroll 57,000 community health workers through a 2-week training online module. But in a country where the differences in social status draw huge parallels, not everybody will have access to home-based care.
If you don't meet some of these preconditions, then it means you can only go for institutional-based isolation or quarantine.
As has been the norm, a COVID-19 patient would stay in isolation for 14 days and be tested thereafter. But WHO has reviewed guidelines and data and found that after the 10th day, even if secretions of the virus are found, those are likely to be breakdown products of the virus that are likely not infectious. This is just part and parcel of the evolving research being found in the new phenomena that is the coronavirus. Gina Kirori, NTV.